week. We start with the nurses' strike, which has entered the second week with no signs of a let-up as the parties in the dispute stand their ground. In Kisumu, the county government is planning to hire nurses on a temporary basis to ease the pain of patients. Laura Otieno is following that crisis. And Laura, good morning. We see now it's day 7 of the strike by the nurses. We have heard the Council of Governors saying that they're not going to honor the demands of the nurses based on the court decision. We have also seen the Salaries and Remuneration Commission advising the COG that they should not honor those higher allowances for the nurses. Yet the pain is being felt by patients. What is it like in Kisumu?
Well, Sam Gituku, here in Kisumu, the health sector is continuing to ail because, as indeed you have mentioned, the Kisumu County Governor had on Friday indicated that according to that advisory by the Council of Governors, then the 34 million shillings that the county had set aside for the payment of the nurses' allowances will not be remitted to the nurses. And while, in as much as he was saying that that was the advisory from the COG, he was also quoting the Commission for Revenue Allocation, which had also directed that anybody that will be making payments out of or rather away without its approval will be doing will be committing an illegality. So the governor was basically saying that the remission of that 34 million shillings into the accounts of nurses would be very, very much unconstitutional. So today we have not been granted permission, but from where we're standing, we are right next to the Kisumu County Referral Hospital, and the situation today seems to be getting even worse because those gates are usually normally open, but today the larger gate has been locked. Only people accessing that gate have to request permission from the security guards in order to access that hospital. Well, I've gone in there doing several rounds to basically see if the situation has changed since the county had advertised a position of hiring temporary nurses on Saturday, that is. But quite inside this hospital, the situation is still the same. The mother-child clinic is not functional at all. There are mothers who have spoken to inside there who are saying they have been told that no nurses around to basically check up on the pregnant women and give vaccinations or rather immunizations to infants. So the situation in this hospital, which was the worst hit because it has nurses who normally run most of the operations in this place, but they have been away for a week now. And Sam, this whole back and forth between the Kenya National Union of Nurses in Kisumu County and the county government has quite affected the residents of this area, some of whom had really banked on the universal health coverage program to benefit hugely from getting or rather quality health services. We managed to speak to some of them who said they are hoping the stalemate will be resolved so that they can at least have some hope in getting quality health care. Most of them are just in the house waiting for a positive sign from the nurses, who continue to stand their ground and say that they will not resume work until their return to work terms are honored. But some, the bigger question that now plays in the mind is, was the Kisumu County government in particular signing the return to work formula without considering the CRA and the SRC's stand in this? Because the governor had clearly indicated that despite the fact that they had set aside the 34 million shillings, then the CRA did not approve of it, and therefore it would be unconstitutional. So the bigger question is, where was the county government putting the consideration of the CRA when signing the return to work formula with the nurses in November 2017, Sam?
And Laura, how serious is the county government of Kisumu in recruiting these new nurses, and where are they getting the money from, based on bearing in mind that there are all those restrictions from all these organs that you're talking about?
Well, so far, Sam, from the facilities that we have visited here in Kisumu town, we have not seen or rather verified any nurse who was taken in following that advertisement that was sent out by the Kisumu County government on Saturday. So maybe some of them will be presenting their credentials today. Of course, we'll be on the lookout to see how many nurses will actually be presenting their papers for that temporary hiring position. But then earlier on, the county government had also said that it has some 300 nurses on contract, 80 of which are at the Jaramogi Oginga Odinga Teaching and Referral Hospital. Well, we visited that facility yesterday just to do a spot check off camera, and there were some nurses, yes, but then the queues were very long, and the people we managed to speak to on the queues were saying that they had not been receiving any service from the nurses who are manning that station. Of course, now the hospital said it has 80 nurses privately contracted, but the situation is still pretty much similar to what goes on at the county referral hospital, because no services are being offered despite the fact that there are nurses in that place. So maybe today is when the nurses the nurses who want to benefit from that temporary hiring program that was advertised by the county will be showing up at hospitals or at the county government offices today. We'll be on the lookout to see just how that materializes from today onwards, Sam.
All right, thank you so much, Laura Otieno from Kisumu, telling us about the nurses' situation in that county. Let's now go to Trans Nzoia, where Colin Shitabai is at the Kitale County Hospital. It's been a week now into the strike. Is anybody letting up on this crisis? Do you have a solution coming soon?
Yes, good morning, Sam Gituku here from Trans Nzoia County, particularly in Kitale Level 5 Hospital. Situation is bad here since nurses started their strike on Monday last week. I'll be talking to Secretary Nurses Union in Trans Nzoia County to tell us what are their plans to ensure that patients here in Trans Nzoia get treatment or get their services. Since they started their strike, many patients have been coming here at Kitale Level 5 Hospital and going back because of lack of services here. I'll be talking to Willie Sufuna to tell us, have you started negotiation with the Trans Nzoia County government so that to ensure patients get your services here?
Since we started the strike on 4th, we have tried to seek audience with our bosses, the CEC and the chief officer, and we have not had chance to talk to them. We sent a memorandum on Tuesday last week, and we could not find anybody in the office. We decided to seek audience with the executive, that is His Excellency the Governor, and we were locked out of the office. We never met him. So there's nothing going on in Trans Nzoia, and we are surprised that the Trans Nzoia management is not taking care or is not taking seriously the issues of the patients, and that's why they are not ready to talk to the union. And what we are now doing is that we want to seek now audience with the legislative, that is the county assembly, so that they can assist us with solve issues. Trans Nzoia has many issues. Apart from the non-compliant with the return to work formula, which is nationwide, we have issues to do with the shortage of supplies, issues to do with the shortage of drugs, issues to do with the shortage of the staff, and issues to do with the general system, the organogram system. The organization structure is so bad, and they are insisting that they will use that bad structure, which they never consulted the stakeholders who are the professionals. So as far as we are concerned, this strike is to go on for some time because they have refused to talk to us. As I'm speaking today, very many all health facilities in Trans Nzoia are not operational because there are no nurses. And we understand the one to flag of drugs. Who is going to take care of those drugs if the nurses are outside? Are they considering the lives of patients, or do they want public relations so that they stay in positions? So what we are saying, we want urgent dialogue with the management so that we can sort out this stalemate and the nurses go back to work.
Mr. Chairman, Edward Cheriot, what is your strategy to ensure that patient does not suffer getting treatment in most of our health facility in Trans Nzoia County, considering the fact you still on the strike and the executive has not come out clearly to negotiate with you?
Okay, thank you very much. I think from the beginning of this strike, we had instructed and advised the general public to seek health care from private facilities, because it is not that the nurses like going on strike. We like serving our patients, but unfortunately, the county government of Trans Nzoia is not ready yet to address our issues. So we still insist that the general public can seek health care elsewhere and in other counties where they have resolved the issues. So as it is now, the strike continues, and we are seeing the situation will even become worse because more counties and more facilities are joining. Right now at Kitale County Referral Hospital, the blood transfusion services will be paralyzed from today because the national facility, which is a blood transfusion, have joined in the strike to show solidarity because they are part of nurses who are entitled to the allowances and the treatment that we are seeking for in the CBA. So I want to apologize or sympathize with the public and tell them it is not the making of the nurses. We are willing to work, but this county government of Trans Nzoia has not even seen it initiated any dialogue with the union. So until they initiate dialogue, that is when we will see some light at the end of the tunnel. So otherwise the patients will continue suffering, but we are insisting that they must seek services elsewhere so that they do not continue suffering.
Okay, you did have about 5 issues which contributed to your strike. Has any issue resolved by the executive or Trans Nzoia County government?
Okay, not even one of the issues have been addressed because we know the return to work agreement and compliance, they are insisting that it is SRC and the national government which will give a way forward. For the other issues, shortages of nurses, they have not employed, they have not advertised. For issues of drugs, we are hearing that they are flagging off some of the supplies, drugs that have come in, but we do not know which kind of drugs, the quantity, or it is just public relation. So as yet, we have not been told what is happening. On the issue of county organizational structure, which was contentious, we think that now the county is acting in impunity because right now on Thursday, they are interviewing a position called Director of Health Corporate Services to cement an impunity. So we are saying so far, none of the issues have been addressed amicably by the county government of Trans Nzoia.
Well, Sam Gituku, it is a story that I'm following up here from Trans Nzoia County. I'll be also seeking audience with Trans Nzoia Governor Patrick Khaemba, also who will tell us the way forward about nurses strike in Trans Nzoia County to ensure that health facility gets enough nurses, get enough medicine and other equipment.